Good evening. I'm very honored to be able to introduce this next speaker of the AMSA Med Talks that we are hosting today. She's a fellow classmate of ours in the Robert Woodard Johnson Medical School class of 2016. And her bio is right there in your program, but I wanted to say a little more personally that Melissa is an amazing individual. Her passion and sincerity has always been a source of inspiration for me, and I'm sure for many of you that know her. She's an incredibly talented young lady, and her talk, when I heard it in the interview, really moved me. And I believe it'll also have a similar effect, hopefully, on all of you and at least enlighten you in some aspects. So without further ado, please welcome Melissa Villars.
I've worn a mic before, so bear with me. Okay, is it on? Can you hear me? Okay. 25%. 25%. I want you to conceptualize that. That's 1 in every 4 individuals. 25% of the adult population in the United States in any given year has a mental illness. 25%. 75%. 75% of individuals with a mental illness or with mental health symptoms feel that people are not sympathetic and not caring towards persons with mental illness. 75%. 38,364. Number of individuals who in 2010 successfully took their own life. 1,300. No matter what field you're in or plan to go into, mental health is not something that can be avoided. It is something that needs to be addressed, and it is something that we all need to be able to talk about. I'd like to take this moment to share with you my own personal experience with mental health, give you a sense of where I'm coming from, and let you know where my inspiration for this talk came from. Now, in my family, I'm the oldest of 3. My sister's 3 years younger than me, and my brother 3 years younger than her. Growing up, we used to love to go outside and run around, and every time we went on a hike, my parents always had to bring an extra change of clothes, because inevitably, one of us would end up in the creek. I think between the 3 of us, we played every sport imaginable, and then some. As we got older, my sister and I got closer, and we used to spend all of our summers sitting by the side of the pool, playing cards, and talking about our friends and talking about boys. My junior year of high school, things started to change. My sister and I stopped hanging out. We used to get into such intense, loud arguments at the drop of a hat. But she was going through puberty at the time, so my family and I all blamed it on that. But it really became concerning when she started to restrict her food intake. 6 months down the road, after countless arguments and so many slammed doors and so many tears, and a weekend full of her just locked in her room with just a jar of peanut butter, my sister admitted herself to the hospital for anorexia. Upon admission, at a height of 5'8", 6 weeks later, she was discharged from the hospital. She came home. She still struggled with her food issues and with her emotional state. And as her food issues got better and her cheekbones and her ribs no longer stuck out, her depression got much worse. I used to joke with my mom that I could tell how she was doing when I came home from school based solely on how much we would yell at each other. Whenever she was in a bad state, it was like she was behind this dark veil. But occasionally, a little bit of her true self would shine through. Like when she'd show me cute kitten pictures or dare me to watch a horror movie with her. My sister tried to kill herself 2 times. After both of which, she ended up in an inpatient treatment. As she went through high school, she got mixed up with the wrong crowd and the wrong substances. She started using narcotics for that momentary happiness and momentary relief that it provided her from her illness. It was during this time that she was diagnosed with bipolar. But it was also during this time that she graduated high school. She went to Ghana for 6 months, and she was accepted into college. She made it through her first semester of college and spent her January term traveling in Bolivia to volunteer and summited the highest mountain in the country. At the start of her second semester, she left a suicide note in her dorm room and disappeared for 48 hours. She ended up in an inpatient facility in Ohio because the car who she jumped in front of swerved in time, and the man stopped to help her out. Since then, she's been back at home. She's been arrested. She's been into inpatient treatment once again. In her most recent stay, she started opening up a little bit, and she's now diagnosed with post-traumatic stress disorder. We think that her PTSD might be at the root of all of her symptoms, and she's back home now, struggling with her bipolar and struggling with her addiction and working so hard on getting through her PTSD. She's seen countless psychiatrists and psychologists and is now doing a PTSD treatment called EMDR, or eye movement dissociation and reprocessing. During all of this time, she has truly perfected her zucchini bread recipe, which is incredibly delicious. My sister suffers with flashbacks, with severe manic and depressive moods, and can no longer sleep with the lights off. She has seen things and has done things that no one should ever have to. She has had things happen to her that no one should ever have to endure. From my side, I've been yelled at, I've been blamed, I've been avoided, I've had countless doors slammed in my face. I've been chased out of my own home when she was at a really bad spot. Weeks will pass where I'll barely see a glimpse of her because she has such a hard time interacting with me when she's not doing well. But through this all, I've come to understand. And I've come to forgive. And though she might not know it yet, I know that I will always be there for her, and I will always love her. Now, I'm not up here because I want to garner your sympathy. If you want somebody to give sympathy to, give it to the one that needs it. Or give it to my father, who has sat up all night long holding her during her flashbacks, and then will go to work the next day like nothing happened. Or give it to my mother, who gets some of the worst verbal lashings I have ever heard, but will sit on the phone all day arguing with insurance. Or give it to my brother, who's now a senior in high school and just got accepted into college. And while she's upstairs arguing with my parents about where she's been or who that was in our driveway, he's downstairs trying to do his homework. We all have our issues, and every family has their struggles. When it comes down to it, pain is pain, and I'm not up here to tell you that mine is any better or any worse than any of yours. That's not the reason that I gave this talk. I wanted to share this part of my life with you so that I could also share with you what I've learned from this experience. As future physicians and current physicians in this field, we're at the forefront of structuring how mental health is seen in society. Society looks to us to be the experts on mental illness along with all other illnesses. They look to us to be the providers of information and look to us for the answers to their questions. When it comes to mental health, because we are seen as the providers of information, it is our role in structuring how the perception of mental health in society, our role in that is crucial. Just as all specialties, be it cardiologists, rheumatologists, anesthesiologists, family practitioners, what have you, just as all specialties need to know about chronic illnesses like cancer and diabetes and hypertension, all specialties all specialties need to know about mental health. Numbers like 25% of the population demand that you be as comfortable talking about mental health as you are talking about diabetes. We need to start seeing mental health in the same light that we see other chronic illnesses. Just as other chronic illnesses can change every aspect of an individual's life, and just as other chronic illnesses can significantly influence other health aspects for an individual, so does chronic illness, or so does mental health and mental illness. We need to start seeing mental illness as equal to other chronic illnesses, not as something completely foreign and different, but as the same thing. Because really, when it comes down to it, with the impact that it has on an individual's life and an individual's health and an individual's family members, it's in that same boat of chronic illness. Because of the stigma that exists in society today, people are afraid or don't know how to talk about mental health. I can't even tell you how many times I had a friend or a family member come up to me, and you could just sense their anxiety as they're trying to decide whether to ask me about my sister or not. And then the minute that they do, and the minute I use a word like bipolar or depression, or she had a flashback today, their anxiety shoots through the roof. It's as if the minute I use that word, we should no longer be having this conversation in public. The minute I use that word, they frantically scramble to try to change the subject. This anxiety can even be seen in physicians. My sister's medical health is always in that column of significant family medical history. And now I've had physicians ask me if I use sunscreen in the summer when I go outside because of my past family history of skin cancer. Or I've had physicians ask me about my diet and exercise regimen because of the history of obesity and hypertension that I have in my family. Never once have I been asked about my mental health. Despite the strong genetic connection that there is with mental illness, despite the stress that a chronic illness can cause on a family member, never once. It's our role as physicians to end the stigma around mental health. And as such, we ourselves need to stop treating mental illness like it's some demon shut in a closet, and if we just ignore it, it'll go away. We need to be comfortable talking about mental health. We need to be comfortable talking to our patients about their mental illness, addressing the concerns that they have, and helping them find the resources that they need. Not ignoring it because we don't know how to talk about it, or ignoring it because we don't feel comfortable. By doing that, by ignoring mental health, you in and of yourself perpetuating the stigma. Now, it's with the words that we choose and the words that we choose to describe a patient's condition to them or to comfort a family. It's with those words that we are structuring that patient and therefore the community's perception of mental health. And so it's with our words that we can choose to fight the stigma or we can choose to perpetuate it. Now, with my sister, I saw her go from this incredibly energetic, outgoing, extremely talented young woman with this full love of life, someone that I wasn't able to recognize. I lost my closest friend to this illness. Just now starting to come back. Something that I was told fairly early on about mental health that helped me to understand that I need to separate my sister from her illness. That person that's sitting there screaming at me, slamming that door in my face, that's her illness. That person that loves zucchini bread and horror movies, she's still there. She's just behind this curtain of her illness. As physicians, we need to see beyond that curtain. We need to separate our patients with their passions and their interests from their depression and from their schizophrenia and from their bipolar. We need to respect the patients who have interests and passions to understand that we're treating not a depressed patient, but a patient with depression. Their disease does not define them. Every individual with mental illness that walks in those doors to your office, they should be treated with the same respect and the same dignity that you give every other individual. We as physicians need to understand and need to reach out to that person that's behind that curtain of mental illness and talk to that person, not to the schizophrenia or the bipolar or the depression. Now, whether the patient in front of you has as serious of issues as my sister, or whether the patient in front of you is talking to you for the first time about their anxiety, as a society, we also need to stop belittling mental illness. We need to stop chalking mental illness up to mommy and daddy issues, or up to an inability of this person to handle the hardships of life. We need to understand that the pain that these patients go through, the suffering that these patients go through, is very real. And though we might not know the cause, and though we might not ever be able to relate truly to that suffering, we need to respect it for what it is and stop chalking it up to an inability to handle life. These changes in our mentality, these changes from seeing mental illness for what it is to seeing that patient and talking to that individual behind that curtain of their mental illness, it's these changes in our mentality that are then expressed in the words that we use that will go a long way to fighting the skewed perception of mental health. But all of this is for naught if we're not comfortable talking about mental illness. If we don't see mental illness as just another type of chronic illness and we can't talk with the same openness about it as we do about obesity. It's our role as physicians and future physicians to fight the stigma against mental health. And in order to do that, we need to start looking at the way that we personally perceive mental illness and the openness with which we talk about it. If I was to come into your office and you saw what I had on my chart, would you ask me about my mental health? How is it that you talk to a patient with depression? Do you see the person with passions and interests that's behind that schizophrenia that's so blatant in front of you? Let's all take a moment at some point today and reflect a little bit about our own personal perception of mental health. Let's take a moment at some point today and analyze how it is that we understand it and the words that we choose to describe it. And let's work to improve that. Let's start talking openly about mental health. Let's talk about mental illness. There's no reason for this stigma around mental illness to exist. And the way that it ends starts with us.